As Congress considers a plan to replace Obamacare, many Catholics are concerned about conscience rights. In other words, forcing a medical professional to perform a procedure that violates their deeply held beliefs. Joining us now is Louis Brown, the director for CMF Curo, which is part of the Christ Medicus Foundation, a nonprofit focused on advancing life issues in healthcare. So, Louis, you resigned your position with the Democratic National Committee over the issue of funding for Planned Parenthood with regards to Obamacare. How does that sort of connect, do you think, with conscience rights in sense of repealing or replacing Obamacare?
Sure. I resigned over the federal funding of abortion in healthcare. Didn't want to see that happen. And I think in the similar vein, folks that are medical professionals, folks that are working in hospitals, running hospitals, folks that are part of different healthcare entities as medical professionals should not be forced or penalized for doing something or not refusing to do something that's not consistent with their conscience or consistent with their religious beliefs. If we're really going to have a healthcare system based on freedom, based on respect for the patient, the provider, based on a relationship between patient and doctor that also respects life, it's very important that we protect conscience rights.
It's certainly something that a lot of people want. What do you think is the likelihood that a replacement plan will actually keep in place those rights?
I think it's very likely. If you look at what Congressman Tom Price has put forward before, if you look at what Speaker Ryan supports, if you look at what Senator McConnell supports as well, the fact that we have a pro-life majority in the House and Senate, I think it's very likely that we'll have protections for the right of conscience, religious freedom, and health care, and other pro-life protections that we as a Catholic community want to see.
You mentioned Tom Price. We just saw Jason's piece about that. What do you think about him in particular, and what do you think it is about his policies that could help?
I think he's an excellent choice. He was an orthopedic surgeon for almost 20 years. He was a professor, assistant professor at Emory University. He ran a very celebrated orthopedic practice in Georgia. I think he's the right man for the job. It's really about returning our healthcare system to one that respects the patient-doctor relationship, that respects life, that protects that patient-doctor relationship, and also one that has a principle of responsibility, that we're responsibility for our own health, but that we're also responsible for our health as a community to protect the poor and protect all Americans, but knowing that we must have a place of freedom so that the patient, the consumer, the doctor has a choice in the healthcare plans and the type of healthcare they receive.
One last question really quickly, Louis. What do you think in terms of the likelihood of a replacement plan that will actually address the issue of consumers or patients being actually able to choose the doctor based on religious beliefs?
Yeah, I think that's going to be empowered. I think that Congressman Price and the team around him are very interested in making sure that the patient has maximum choice possible, maximum freedom possible to choose their doctor, to choose their hospital, and also making sure that's affordable in a way that respects them, in a way that empowers that relationship, and in a way that is really responsible both for the patient and the provider.
Louis Brown, principal with Christ Medicus Foundation, and your website, by the way, is mycatholichealthcare.com if you want to learn more. Thanks, Louis.
Thank you, Wyatt.